Good afternoon. My name is Dr. Deonza Times. I am a master's student in health policy at the Harvard Chan School of Public Health and a Commonwealth Fund Fellow in Minority Health Policy. It is my honor to introduce John Lechleiter, PhD, Chairman, President, and Chief Executive Officer of Eli Lilly and Company. Dr. Lechleiter has had a non-traditional climb to his current position as CEO. He truly learned the pharmaceutical industry from the ground up. He initially joined Eli Lilly in 1979 as a senior organic chemist in process research and development. 3 years later, in 1982, he became head of that department. In 1984, he began serving as Director of Pharmaceutical Product Development for the Lilly Research Centre Limited in England. He later went on to hold roles in project management, regulatory affairs, product development, and operations. In 2005, he was named President and Chief Operating Officer and joined the Board of Directors. Ultimately, in April 1st, 2008, Dr. Lechleiter was named CEO of Eli Lilly and Chairman of the Board of Directors in January 2009. Dr. Lechleiter earned a bachelor's degree in chemistry from Xavier University and his master's and doctoral degrees in organic chemistry from Harvard University, where he was a National Science Foundation Fellow. He has received honorary doctorates from multiple universities in the U.S. and abroad, including Marion University in Indianapolis, Indiana, and the National University of Ireland. Dr. Lechleiter is a member of the American Chemical Society and Business Roundtable. He serves on the board of the Pharmaceutical Research and Manufacturers of America, as chairman of the U.S.-Japan Business Council and of United Way Worldwide, and on the boards of the Life Sciences Foundation and the Central Indiana Corporate Partnership. He also serves on the boards of Nike Inc. and Ford Motor Company. For all of his professional accomplishments, it is his insistence to make diversity of his scientific workforce a priority that resonated most with me. Under his leadership, Eli Lilly has shown progress year after year in diversity initiatives and climbed Diversity Inc.'s top 50 list. Before I turn the session over to our moderator, Ashish Jha, K.T. Lee, Professor of International Health and Director of the Harvard Global Health Institute, please join me in welcoming Dr. John Lechleiter to the Voices in Leadership series at the Harvard T.H. Chan School of Public Health.
So John, thank you so much for coming. Boy, that set of responsibilities as was outlined, I don't know how we fit this in, but really appreciate you.
I'm glad we did.
So I am too. So I'm going to jump right in by, if you don't mind, starting off with a topic that is very much in the headlines, which is this new law, this very controversial law in Indiana, and what I thought was a very unusual move by you and the CEOs of other Indiana-based companies to speak out against it, or to at least ask for clarifications around it. For those of you who have not followed this very closely, the Indiana legislature passed and the governor signed a bill ostensibly to defend religious liberty and practice of religion, which I think we all agree with, but it raised very serious questions about protections, some fundamental protections for gays and lesbians as well as other groups. I would love it if you could talk about, when confronted with a difficult issue like this, what is the thought process behind which you decide you're going to take this on? Why? And then what's the process that you go through to put yourself and your company very much into the public space in saying we need to make changes to this law to defend an important group of people?
Well, it's a very good question, and this has been all over the news. In fact, it's been in the global news arena the past week or so. And of course, our company follows this like we would follow any piece of legislation in our home state. To put it in perspective, Lilly has about 38,000 employees around the world and about 12,000 work in Indiana. I think to make things more challenging for us, we're sort of the last research-based pharma company in sort of middle America. I mean, it's more along both coasts. So we have to be very attuned with the requirement that we be able to recruit and retain people from all over the world, not just from both coasts, to come to work in Indiana. We're interested in making sure, we have a vital interest in making sure that Indiana remains a welcoming place, a place where individuals not only would want to come to work, but would want to stay and grow and develop as people and as professionals and be important parts of the community. We think that that is the reality of Indiana, but we were concerned with this legislation that not for what it says about religious freedom, but for what it sort of leaves open to question about whether or not it would affect the rights of particularly the gay and lesbian community of people based on either sexual orientation or their gender identity. We want that clarified. We want to make sure that in the name of protecting religious freedom, we're not introducing something that would enable those individuals to be discriminated against. It's another decision altogether to decide, when do you sort of put the company and the company's name behind this. We felt that this was such an important issue, not only for Lilly and you could say for our self-interest, but for the interest of the broader community. And obviously 8 of the other largest employers in Indiana agreed with us and are of like mind, and that's why we sent the letter we did yesterday, which I think is on the front of USA Today, someone told me. So, but you have to weigh these thoughts carefully. Lilly can't weigh in and would not weigh in on every issue in the public discourse. Earlier this year, we weighed in on another local issue that had to do with early childhood education, because we were so concerned that unless we got traction here, we just were not going to be able to generate within the community the strength and the numbers of high school graduates and people who are really employable in a high-tech industry like ours years and years from now. So we weighed in on that as well. And I think it is, as you say, it's a little different than it might have been in the past when I think large corporations, particularly a company like Lilly, 139 years in Indiana, viewed as, large, conservative, we might have remained silent. But I think on these 2 matters in particular, we had to speak up.
Yeah. So as I saw that decision and I had a chance to read some of the things you had written about leadership, and I'm hoping we can go back to talking about a story that you describe from the late 70s, I think, of Sir John Harvey Jones, who was the CEO of a major chemical company in England, asked to describe the attributes of leadership. I'll let you tell that story, but then I'll come back to this decision and how it fits into that.
Well, I tell this story a lot, even inside the company. We lived in the UK from 83 to 86, and I remember watching an interview on BBC while we were there of Sir John Harvey Jones, who at that time was near the end of his tenure as the CEO of ICI. It was the big British chemical conglomerate, really on its knees in the 60s and 70s due to a variety of factors. He was a lifer at the company. He joined him as a chemical engineer. He has a very imposing presence. He had this long black hair and a Fu Manchu mustache. He kind of looked like Vlad the Destroyer, but he was the CEO of ICI, and by that time sort of legendary in terms of his ability to turn the company around and a sought-after speaker. So I thought, I'm going to take notes here. They're talking to John Harvey Jones. And so the interviewer asked him, much like you're asking me, what are the most important attributes of leadership? And I got my pen and paper ready, and he said something that I didn't expect, and I probably didn't understand until some number of years after that. He said, well, that's easy. It's 2 things. It's courage and physical stamina. I was would you think of courage and physical stamina? But after a little more white hair and gray hair, I've come to realize the guy was right. And I think that leadership fundamentally involves doing something that has a certain degree of difficulty. There's always a from to in leadership. You're from this to that, and that degree of difficulty means that oftentimes you have to overcome resistance, and overcoming resistance requires a modicum of courage under any circumstance, I believe. The position Lilly took on the matter we just talked about will not be popular with everyone. You have to be able to sort of weather that and brook that to be able to, before you decide to go there, okay? I think physical stamina, I tend to translate that down into persistence, stay-to-itiveness, grit, determination, because there's many setbacks along the way. Lilly has just gone through a period where we've lost the patents. The patents expired on our 4 largest products, and all of you know how this works. The generics come in. It's a very efficient process, but we just watched about $10 billion of revenue off a base of maybe $25 billion melt away over a several-year period. That was challenging enough, but we couldn't have foreseen in 2008 the Affordable Care Act, which fundamentally changes the way much of healthcare is delivered in this country. We could not have foreseen the Great Recession, which was just the storm clouds were just gathering. So, any journey of leadership always requires overcoming obstacles and dealing with adversity, and I think that's where the physical stamina comes in. I think knowing that, I had a serious health condition a few years ago. I had an aortic aneurysm, and I was hospitalized. I had surgery. And I checked out for 2 months. There was no question in my mind. I wasn't going to try to halfway do the CEO job. I just turned the reins over, as Kate knows, to our CFO. He became the acting CEO, and I recuperated. I recovered from that surgery successfully. But you can't do the job of a leader without physical stamina.
Wow. So you describe these 2 traits, and yet one of the things that you've often talked about is that it's hard to quantify or describe in great detail what great leadership looks like, because it varies based on context. So do you think these 2 things are the 2 things in your mind, I'm not suggesting they're the only 2, that are constant and other stuff varies, or I guess how do you conceptualize leadership in different contexts? Because you can imagine leadership in an academic context, in your first job, what leadership looks like may be very different from if you're leading a Fortune 50 or a Fortune 100 company. So can you talk about leadership in different contexts and what that might look like?
Sure. I think that there certainly is context. I think leaders in different contexts, leadership can look differently. I don't think it's necessarily also a hierarchical thing where, we expect our president to be a leader, we expect a CEO to be a leader, a department chair to be a leader. Okay, I think leadership can happen at any level. I mean, I see within our company lots of examples of leadership on the part of people in entry-level roles, and I admire that. I try to point that out when I see it. I think a constant, though, I think courage and physical stamina are sort of, you've got to carry those in your bag with you, as you go through this journey. I think leaders fundamentally take a stand about something or something. They are going to stand for something. They're going to be seen as being supportive of something that maybe doesn't exist today but might exist tomorrow. JFK famously took a stand in 1961. We're going to put a man on the moon by the end of the decade and return him safely to Earth. So there's always sort of a goal aspect to leadership. I said the from to earlier, but I think leaders take a stand. They're unmovable from that stand. They're flexible enough to think about the ways and means of accomplishing the goal. They try to create a big tent so that there's no leadership without followership. You've got to invite people in and convince people at the end of the day that what you stand for is worth their support. If someone said, well, in 7 years tomorrow, I guess, of my being CEO, what would I stand for from an industry perspective? I think most people in the industry who know me would say I stand for the continued robust investment in R&D and a policy environment that encourages innovation. I mean, I think that's what all I've been talking about for.
Yeah. So here's for us at the school, in some ways, the million-dollar question. So can this be taught? Can you teach leadership to people? And if yes, how do you do that?
So it's a nature or nurture question. I think I'm probably more on the end of the scale. If it's, you say all leaders are born versus, all leaders can be taught to lead. I'm probably more on the end of the spectrum that leadership can be learned. I think there probably are some people who are born with certain attributes that enable them to be seen as leaders. But we were talking earlier, persuasiveness can't be confused with leadership. I mean, there's somebody who would like in this city somewhere would like to separate me from my money, who I'm sure is very persuasive. It doesn't mean that they're leaders. I think on the other hand, my experience has been that when individuals are given the opportunity to lead, and sometimes it's forced on you, and when they have around them people who can coach and mentor them, and they have role models, and talk more about that. I think role models are very, very important. Many people can step up to leadership. I mean, when I joined Lilly as a chemist in November of 1979, did I really think I was going to be the CEO of Lilly? I mean, I would have laughed out loud. I mean, nothing could have been further from my mind, but I was given opportunities over time, first to lead a lab, then to lead a department, then to lead a division, and then I was given responsibility to lead the Community United Way campaign. And I mean, you have all these different experiences, and you find, I can do this, and I learn more as I go along. I learn, how to be a better leader as I go along. It wasn't conscious, but in my case, I was fortunate because it happened. And I believe that most people who walk in our door can develop leadership, can be leaders in the course of their careers.
So what's your strategy or your company's strategy for developing the next generation of leaders at Lilly?
Well, we have, first of all, we talk a lot about leadership. And as I say, leadership does entail some degree of change. I mean, if all we were asked to do was to maintain the status quo, all we would need is good managers. We wouldn't need leaders. We need very good managers. And sometimes, I'm not knocking management, sometimes that status quo, certain aspects of that status quo have to be maintained in a time of change. So, I think when someone joins Eli Lilly and Company, they hear about leadership almost from their earliest days. I mean, we have at different levels opportunities for people to learn more about leadership, to assess their own leadership skills, to study leadership. But we think about 70% of what people learn occurs in the course of their normal day-to-day work. We think about 10% happens in the classroom. We think about 20% happens from coaching and mentoring. We call it 70-20-10 model. It's not a Lilly model, but I mean, we tend to believe that is probably the best learning lab for any of us is our day-to-day experiences. But you have to be willing to sit back and reflect on those experiences. Churchill once said about one of his enemies in Parliament, he said, "Occasionally Sir so-and-so stumbles across the truth, but he quickly collects himself and goes on as if nothing had happened." And I think we have to be conscious of when we stumble across the truth and be aware of situations where we either succeeded as leaders or failed as a leader, and try to learn from that. But you have to step back and consciously do that. We encourage our employees to do that as well.
Got it. Great. So students in the room, students who are watching, who are here because they want to not only learn a body of knowledge, but want to prepare themselves for leadership opportunities that might come along, advice at an early stage of how you do it, how you prepare for it, how you, if you stumble across that opportunity, don't go along as though nothing happened?
Yeah, I think that that leadership opportunities for leadership abound. First of all, and I don't think any of us typically have the opportunity on a day-to-day basis to take on what I call a save the world or boil the ocean kind of leadership job. They tend to be in small things. I had leadership responsibilities when I was in college for volunteer organizations. In fact, sometimes volunteer organizations are almost the best way to develop your leadership because you have a lot of responsibility, but you don't have a lot of authority. And I think that, when you have the position power, people sort of do what you say because you ask them to do it or demand that they do it. When you don't have that, you've really got to bring people along. They've got to want to follow you because they see something that's very compelling, that's in their interest as well as the organization's interest. So, I would say to students, practice. I mean, practice your leadership. And if you're involved in a student group, if you're involved in some kind of a fundraising campaign, if you're doing something online with a group of friends, I mean, where are the opportunities to show that leadership? What is it that you stand for, and how is it that you can bring people along with you? Communication is an essential part of leadership. When I said earlier, leadership usually involves some degree of change, it means that you typically have to overcome resistance. And sometimes it's not hostile. It's not people that are hostile to you. It's just people tend to get comfortable with a certain way of doing things or a certain way of thinking about the world. To move those people, you have to present a convincing argument, but you have to repeat that about 500 times sometimes. So, as we looked at this journey that we've been on at Lilly in the past 7 or so years, I described this huge patent cliff. I only said about 5 things the whole time. I mean, I found different ways to package though, but I basically said, we're going to face this huge patent cliff, and we don't have the pipeline ready yet to launch and replace all that revenue. So we've got to take some actions within the company to deal with that. We had to downsize parts of the company. We had to cut costs. Having said that, we're going to keep investing robustly in R&D. We believe we have an early stage pipeline that will mature. We're going to do some other things to help grow our revenue during this period, and we're confident of the outcome. And here's your role in that process. And then something about the fact that I think today there's never been a better time to do what we're doing, given the maturity of the science, the opportunity we have to make a difference in medicine. So, I mean, thematically, that's basically all I've talked about for 7 years. And you're talking about leading, a huge company. Obviously, lots of those conversations have to take place at lower levels in the organization. But I think being articulate, being able to communicate a point of view, being seen as someone who has integrity and who legitimately cares about not only the cause or the stand that they're taking, but the views of others. I think these things are all important for students to think about.
So I'm going to shift gears talk about something you brought up, which is the most important change in the healthcare delivery system and the healthcare system in America in the last 5 decades, the Affordable Care Act. It came on soon after you took over. How do you see the pharmaceutical industry navigating the waters over the next 5 to 10 years? I mean, beyond that, who knows? Timelines I don't speculate on what's going to happen in 20 years, but just over the next 5 to 10 years, as we move towards larger health delivery systems, more consolidation, we move towards trying to do more value-based payments, more measurement of quality, more IT, all of the changes that are happening in the delivery system. It's a different world. It's a different world for you guys. How do you see yourself, but also the industry navigating that kind of more broadly? And what are the challenges that it poses? Yeah,
it's a very good question. I think that, first of all, the industry supported the Affordable Care Act because it was difficult for us to see when we believe, as we do, that medicines are an essential part of preventing disease and treating disease. It's very difficult to see 50 or 60 million people sitting on the sidelines hoping, almost by chance, that their situation is going to be such that through emergency care, through charity or whatever, they're going to get access to our medicines. Didn't make any sense. So we need a system where everybody can access insurance coverage. I mean, I think that's, and we've taken a lot of criticism before, during, and after that, but I maintain we're in the right place there. With respect to sort of people ask me a lot, well, what's been the impact of the Affordable Care Act on the industry? I think the measurable impact has been that through the fee, which is assessed of all manufacturers based on our sales, through increased Medicaid rebates, and through monies that are allocated to help seniors bridge the Medicare donut hole, Lilly has roughly put about $500 million a year or more into essentially into the cause. Okay, I mean we're paying from the bottom line, as it were. I think in terms of when the law was passed, people said, well, this is going to be a boon for the pharmaceutical industry. That's the only reason these guys are supporting it. So they're going to have a lot more customers. I wouldn't say that there's been a huge uptick that I can immediately assign to the Affordable Care Act. I mean, let's face it, today more than 80% of prescriptions in this country are filled with generic drugs. So 4 out of 5 prescriptions somebody's going to get written is probably going to be with a generic. But having said that, I think we're in a better place when people have access to our medicines as well as to generics. And I think one of the things we're concerned about, frankly, is as we've seen these individual insurance policies come out of the exchanges. Yes, the premiums are low, but in some cases people are getting a rude awakening that the copay or the deductible is so high they can't access the medicines that their doctors are prescribing. Well, that's not health insurance. I mean, that's something disguised as health insurance. So we've been quite vocal in saying a good health policy is one that enables you to be able to affordably access the medicines that your doctor prescribes. That's a decision the doctor makes. If someone is getting a branded product or a generic product, well, we have to compete based on the merits of the products, and we're obviously, that's the business we're in. So.
Right. Good. So I am going to, at this moment, open it up to questions and answers from the answers from you, questions from the audience. And let's actually make sure
I can't ask questions?
You can. And in this audience, we often like to do the question and answer from the audience, but I'm kidding. But we have some microphones, and so if people have questions for John about leadership in general, about Lilly and its strategy and how it's been thinking about navigating some of these difficult waters, wherever you guys want to go, I'm happy to open it up and see what questions are percolating out there. Dean Frank.
Hi, John. Thank you again for being here. You have those magic 3 letters after your name, PhD. You come from a very strong academic background, got a PhD here at Harvard. A lot of our students are following that pathway. But most people with those letters continue in academic settings. You went into the world of industry and are now leading one of the top knowledge-intensive companies in the world. What are your reflections about that transition from the world of science and research to the world of leading a large multinational company?
Yeah, that's a very good question. The transition for me from graduate school wasn't terribly abrupt because I went from working at one lab bench in Converse Hall across the river to working at another lab bench at Lilly, working on projects that use the same skill set. We employ hundreds or thousands of MDs and PhDs in our company. There's I won't say it's an academic environment, but there are aspects of that would be recognizable by anyone in academics. We encourage people to publish papers. We encourage scientific discourse among our scientists and increasingly reach out to engage with other scientists in other companies as well as with academia to do our work. I will say it was a transition though from it was a significant transition to move from the lab. I remember the day I sort of shut down my lab, and they said I could go back, which means I couldn't go back. And I knew it was sort of a point of no return. But in those early days of being sort of leading groups in our Lilly Research Labs, my first several management jobs, I sort of lived vicariously through the scientists. I found I enjoyed it because I could go in their labs and they tell me what they're doing, and I understood it, or to a point. Today they think I understand a lot more than I do. Okay, but I found that it was fun to be in a position where you could help these scientists get done what they wanted to get done. So that really eased that transition. And we have many people in management within our company who started out as scientists, as I did. Not everyone chooses that path, and we don't force everyone on that path. But there are ways that I think we've learned to sort of better help and manage that transition for those people.
Let's get a follow-up question to that. One of the questions that people often ask about why is drug development so hard, so expensive, why does it take so long? I mean, some of it is just, it just does, right? I mean, but there's another sort of debate that I've heard, and I wondered if you could speak to this, about how disciplined is the R&D versus how much creativity, and you have a lot of very smart people who probably wouldn't be that happy if every morning they shut up and were told exactly what to do, right?
We'd have a rebellion.
Yeah. Part of what makes them excited to go is that they have a bunch of their own ideas and they get to play with those ideas.
Yeah.
And you want to foster that.
Yeah.
But you also want to foster a certain amount of discipline in focus.
Yeah.
And that seems to me to be a tension, and people have wondered aloud whether if the industry shifted on that in one direction or another, whether it would be more effective or less effective. I wonder if you could talk about that.
I think we have a pretty open environment. I mean, I think that we really leave it to our scientific leadership to talk about the how, the details of the how. What we've tried to do, though, in recent years, and your question is very topical, is to better define what areas, broadly speaking, do we want to work in. And this is important. When I joined Lilly in the late 70s, we were then, like we are now, one of the largest pharma companies, but we were, if anybody had an idea, it didn't matter what therapeutic area it was in, people tended to pursue those things if it looked like there was an interesting lead. Today we're saying it's really cancer, it's diabetes, and of course diabetes gets into cardiovascular complications a little bit. It's neurodegeneration. We have a leading program in Alzheimer's, and then we have some nascent programs in pain, looking at some new mechanisms for treating pain, and also in immunology, mainly autoimmune disease. Those really define the scope of what we're working on. And we've recently sort of realigned parts of our research and development efforts to better line up with that. And then you can say, well, within cancer, we can't do everything. So we talk about cell signaling, tumor microenvironment, and immuno-oncology. Those are the three spaces within cancer. But how we approach those things, who we choose to work with, because much of what we do is in partnership with academic institutions, small biotechs. We cut a pretty wide swath. I don't try to get involved in managing that. We really do have to enable our scientists to have that, maintain that balance with the freedom to operate, to think a little bit sometimes off the track, and yet we have, as a corporation, have to have a certain discipline to expect that we have a realistic chance of getting results at the end of the day. Recently, I've been more adamant, I guess is the word, about sort of making sure that we're competitive within these spaces. How do I say this? 10 or 20 years ago, I don't think there was as much at stake in being first, second, or third in a disease category. And sometimes, you could be years behind the leader and still come up with a product that had its own value, and you get reimbursed for that and all that. I'm trying to encourage our scientists at all levels to stay much more abreast of what the competition is doing. And it's not always competition, it's science anywhere in a particular category, to make sure that if we're going to invest there, we have a reasonable chance of being competitive with others. I think that's in terms of getting a drug to market and being, say, first, second, or third. This is something we're talking more and more about. Because I think the marketplace is just that much less forgiving today.
Got it. And it's really partly driven by the shift in the economics of how we.
Yeah, I think so. Yeah. Now, if you come along in your fourth or fifth, but you're better. I mean, Lipitor was the huge leader in that statin class, and it wasn't the first, but I think, and it's not our product, by the way, but I think. It did so well because it had certain advantages that physicians felt were advantageous for many people. So.
Right. Go ahead.
Hi, my name's Rosa. I'm a health policy student here, and my question is on clinical data transparency. So some of your competitors, GSK and Pfizer, for example, are driving this push to open access to patient-level clinical trial data for the wider medical and research community. And my question to you is, do you see this as a threat or an opportunity to the pharmaceutical community?
Well, I think ultimately it's an opportunity. I mean, Lilly has been at the forefront of transparency. I mean, we were among the first. This is prior to any legislative action. Back in 2007, I think we were the first company to disclose all the non-clinical grants that we made. We've several other things that we've let in disclosure over the years. We're obviously with the Sunshine Act, we have requirements now here in the U.S. and soon next year in Europe for disclosure. I think we can find the right balance between disclosing the data and protecting, first of all, patient privacy, which is something we have to be concerned about, and then protecting information that may be confidential to the company. And I think that there's some good to be done there. I mean, I think that researchers having access to large databases of patient of information, I think you would imagine could be a terrific substrate for further work and queries and planning further research. So, I think it's inevitable that the transparency movement within the industry has a full head of steam behind it, and I think that Lilly's going to continue to be part of that. Yep. Thank you.
Diane. Hi, I'm Diane Worth, here at Immunology and Infectious Diseases. Sort of a question, maybe asking you to use your pharma organization hat. Neglected diseases that really minimally affect people living in the U.S. or Europe, yet are major health problems: malaria, tuberculosis, the neglected parasitic diseases. From an industry standpoint, I mean, clearly basic discovery can be done in academia, but the actual production and, sort of the development of drugs and the production really are an industry function. And I just wonder, Lilly has now moved away from infectious diseases, so you're not directly involved, but in your broader roles, what do you think the role of industry is? What novel ideas are there to be able to continue to discover and then deliver such therapeutics or vaccines to neglected populations?
Yeah, it's a very good question. I think a partial answer, came from an industry perspective with the London Declaration a few years ago. And I have to give credit to the Gates Foundation for really spearheading that. Most of our CEOs meet with Bill Gates once or twice a year, and so he's vitally interested in making sure that to the extent possible, the foundation works with us to either incentivize drug development in some of these areas or to connect the dots and enable people who may be working in one of these neglected diseases to at least have access to our chemistry libraries. The one thing Lilly is working on, we've been very involved with Gates in this TB drug discovery initiative, where half a dozen or so, there may be 8 companies are now involved. Essentially, we've opened up our chemical libraries, and we're working with the IDRI group, Infectious Diseases Research Institute, based in Seattle, to do secondary and tertiary screening of these molecules in their TB screen. With the goal of having an oral therapy that can successfully treat the disease in a 1-month course of treatment. That's kind of been the ambition of this group. We have several of our scientists who are quite involved in this, so even though it's not a mainstream research effort for Lilly, you're correct. We essentially ran into a brick wall in the area of infectious diseases in the early 90s, and we moved our research over to neuroscience and other areas, but we still maintain that effort. And I think if you look at Sanofi, you look at Pfizer, you look at a lot of the other companies, particularly the companies that are in vaccines, which we are not, I think more and more attention is being paid to this. I think the question becomes, how do you sustain that? How do you incentivize it? How do you essentially reward the risk takers for having taken the risk to begin with? But
That's great. Yes, go ahead.
Hi.
I'm sorry, one more thing I wanted to add. I do see, as I read the literature, just as you do, and what's written in the public space, I think more and more companies are beginning to move in, or you could say back into an infectious disease, and partly because the FDA, there are some incentives there, and there may be others coming in this legislation coming out of Chairman Upton's committee that would make that more enticing. But over the years, I've heard people say to me, "Well, you guys must have gotten out of infectious disease because you couldn't make any money on a 7-day course of treatment. You'd rather be in chronic disease where you're treating people for the rest of their lives." I wish we were that clever, but that wasn't the thought process at all. Lilly wrote the book on a number of vancomycin, erythromycin, Cephalex, and tobramycin, cefaclor. All these molecules came out of work we did in partnership with others or in our own labs. And we had a 30 or 40 year history of leadership in infectious diseases. We hit the wall. I can tell you personally, we tried to come up with what is the next iteration on the cephalosporin nucleus. How can you do better than vancomycin? And frankly, nobody. Vanco, discovered in the 50s, is still last line of treatment for many of these very difficult to treat organisms. So we would have loved to have done more in that area. We'd still be in there today, but scientifically, after cefaclor we had something called loracarbef, which was a Carbis FM. It didn't do very well because frankly it wasn't demonstrably better than what was already out there. So if the science has to get us there. And it turns out these bacterium are pretty tough little guys. They've been around a while. They've evolved.
So can I just follow up?
I'm sorry, I cut this. Go ahead.
Well, the quick question is, so the broader scientific enterprise of our country, primarily funded through NIH, has seen some pretty tough times. Does that worry you about tackling some of these really difficult issues? Do you think, do you still think the best days are ahead of us on scientific discovery?
Well, I think we've made a big mistake in terms of in terms of our funding of the NIH, and we should be funding it in a more robust way. In constant dollars, I'm told the NIH funding peaked in 2003, not last year, but more than 10 years ago. Francis Collins makes this point. This is the wrong time not to be investing in the life sciences. We're starting to make sense of a lot of the information that sort of began to flow out of a big pipe with the Human Genome Project and others that followed. Our understanding of some of this disease biology is exquisite. Now that doesn't automatically mean we're going to get new medicines from that, but I don't think there's ever been a more opportune time for investment. And what the NIH, in my view, has done best is to really help elucidate disease pathways and ultimately targets. If you said to me, what's the hardest part of discovering new medicines, whether it's for Alzheimer's or whether it's for malaria, it's having good targets. Our industry spends only a little bit of what we do. We can't afford to spend as much as we might like to discover new targets. Occasionally we do. Lilly's had a few over in recent years, but what we'd rather do is to once a target's elucidated, figure it out how to make a drug, an antibody, or a small molecule that interacts with that target. We've gotten a lot better at doing that, yep. but the number of new targets hasn't increased commensurately. I'm hopeful that it will, and I think the NIH plays a big role in funding the research that really leads to that. But we need to increase the level of NIH funding.
Sorry, you waited very patiently. Go ahead.
Thanks. I'm Shelley. I'm a student in biostatistics. I think my question probably pertains to some of the students in the room. I think we probably find ourselves in similar situations as when you first started at Eli Lilly, in the sense that we maybe know where we're headed for the next couple years, but maybe we don't have a sense of our long-term trajectories. And I'm just curious, kind of in your career path, as you sort of were given new responsibilities and had new experiences, how did you sort of manage these like short-term sort of goals that you had and very long-term career trajectories, career goals, and as you moved along your career?
Yeah, that's a very good question. I get asked that a lot. I think that my advice to people in your position, or people even deciding, that even don't know what they want to do in the short term even, I would say follow your passion. life is too short not to love your work. And I would say that that's a good place to start. I mean, make sure that whatever you decide to do as soon as you finish your program here is something you're excited about, that makes your socks run up and down, okay? And then I wouldn't get, I've never really thought, I mean, I need a job in 1979. We had a young son who was born at the lying end, or that's what I still call it. So what is it now? The women in Brigham's. And he and I and his mother had a couple dimes to rub together. And I wanted to do chemistry, and I needed a job. And it was right after the recession. 70s were a tough time. I was told in 1975, you got to be crazy going to graduate school in chemistry. Thousands of chemists were being laid off in this country in the mid-70s. And I figured, well, it's 4 years, and I'm, I got this NSF grant. I can hide out for 4 years, and hopefully the tide will turn. And of course it did. So I would say pursue your passion, do something you're really interested in. The opportunities that you have today in this world are completely, I mean, just 10 times more, 100 times more than the opportunities that we saw before us, at least, or had before us in 1979. So you don't know what's going to come along. And you'll look back in 5 or 10 years and say, well, this led to this, and this led to that. I wouldn't fret too much about your long-term career goals. You've got a great Harvard education. You're bright, or you wouldn't be here. You're presumably ambitious, and do something you're passionate about and interested in, and opportunities will open up. I told you I was glass half full, okay?
Or even 3/4 full.
Yeah, 3/4.
More hands. Did you have it?
Yeah, I had a quick question about bringing entrepreneurship into the domain of public health. Usually our students are not very aware of this, nor do we as their professors. So do you have any views on that?
Well, I think the great problems we face, the challenges we face in public health, whether it's in this country or around the world, demand new approaches and new thinking. And there's great evidence of that. I mean, there are lots of interesting and exciting things that are being done. Paul Farmer and Jim Kim came to Lilly a dozen or more years ago and told us that 2 of these older anti-infective drugs, cycloserine and capreomycin, which had been on our price list since the 50s, were proving particularly useful in treating MDR-TB, where they were working in Haiti. We had no idea. So we made initially a donation of medicines, but then that hatched something called the Lilly MDR-TB Initiative, which we launched in 2003. We've invested about $200 million in transferring the technology to make both of these drugs to companies in China, India, Russia, and South Africa to enable the creation of markets in those countries for those medicines, and then working with 24 healthcare agencies, from Doctors Without Borders to Harvard Medical School, to make sure that healthcare workers are trained on the DOTS therapy approach and trained to use these medicines. So this was an example of a very entrepreneurial approach to treating one aspect of one very difficult to treat disease, but we've seen so many interesting creative ideas come out of this, not driven by us so much as by our partners. And we never would have happened if Paul and Jim had not knocked on the door one day and said, literally, we need to tell you about this because we need your help. We responded, but I mean, Paul may be the most entrepreneurial, healthcare worker in the world. I don't know, but we need new approaches, and this is one thing that I've always thought Harvard could do so well with the business school, the Kennedy School of Government, the Harvard School of Public Health, the medical school. My dream is that out of Harvard will come thinking that crosses boundaries and borders and enables those of you who know public health to enlist others, maybe some people who know business and some people who know one aspect of medicine or the other, some people that knows policy, to really work together to make to put us on a different path in terms of dealing with with some of these problems. You know, the old adage is, you know, that definition of insanity, you know, doing the same thing over and over again, expecting a different result. We talk about that within Lilly a lot. We need new approaches, and we need new thinking. And I think to the extent you're encouraging that through this program, through other things you're doing here at the school, is terrific.
Hi, I'm Deonza again.
You did a nice job with the introduction.
Thank you very much. So my question is kind of piggyback some of the comments that have already been made. You know, you spoke about the plethora of opportunities available, how you focus on research and development, on needing new ideas. So my question is, how much research and development do you put into the communities around you and bringing in homegrown talent and exposing communities, children, women, maybe to careers that they don't have exposure to? Because I really feel like we are losing a lot of opportunity and a lot of talent and people that never get a chance.
Yeah. Well, without going into great detail, we have a foundation, which is our company, sort of our company giving. It's not the Lilly Endowment, that's the big kahuna, but the foundation is the way Lilly gives back. And we have narrowed our focus from, you know, essentially giving money to many different organizations across our community to focusing on science and math education, K-12, for women and minority group members in our community. So that is our focus. That is the major focus of our foundation, and we do lots of things to help accomplish that. Internships, school-based programs, partnering with others in our community who are trying to do the same thing. Because to me, I view it's an untapped resource. It's an untapped resource, and we're trying to do what we can locally, and then in some cases we've got some national level, some work. But I believe you've got to start at home, and we have a great opportunity in Indianapolis to make that look different in the future.
So we have about 3 minutes left, and I'd love to see if you have any closing remarks, and then I'll just wrap us up.
Yeah, I think I'd say three things. One, we have talked much about humility today, and I think humility is usually befits a leader. I think that leadership is an incredibly humbling experience. You know, the last 7 years for me as Lilly's CEO, there's many things that I might have thought we could plan for and navigate through, but there were lots of things that came along that failed. We had molecules that failed in the clinic. We had other issues we had to deal with. So, you know, I think that I look for humility in a leader, and I think humility means that you have the courage, the inner courage to face reality, to recognize that you don't have all the answers, to ask others for help, which you inevitably need to accomplish your ends. You know, I talked earlier about building a coalition. I think leaders try to make the tent as big as possible. I think sometimes in this day and age where we always need to be fighting with each other, and you know, look at the Congress and people take positions. You know, taking a stand on something doesn't mean that you're completely inflexible about how you get there, or that you don't take into account how others see it, or how others can actually make what you're trying to do more powerful. So there's a certain openness, humility and openness, I think, are important traits of a leader. And finally, I'd say I think leadership can, get back to the original point, I think you can learn. Leadership can be studied. I think all of us around us have people that we view as leaders. I think sometimes it can be as simple as studying them or looking at asking the question, what makes them effective and what can I learn? And you can read books. I mean, the most extraordinary story of leadership that I've read recently was 1776, this book by David McCullough. It just tracks George Washington from January 1st, 1776 to December 31st, 1776. And I never knew all that. There's a reason why this guy's called the father of our country. But I think as you read that book, and you think of courage and physical stamina, and you think of humility, and you think of persistence, all these things resonate. But those stories resonate with Martin Luther King. They resonate with, with Gandhi. They resonate with so many people. So read about someone you're interested in, and I think that's important. It's helped me.
That's great.
Yeah.
And it's a phenomenal synthesis of everything you've talked about for the last hour, and I'm not going to try to repeat it, but I want to add one more point that you brought up, which I loved, which was the notion of find an opportunity where you have a lot of responsibility but not a lot of authority. It's really good practice for leadership.
I think you probably have some of that here.
I love that. I thought about all the ways in which I too could get a lot more practice in leadership. John, this has been an extraordinary
I've
privilege.
enjoyed it. Thank you
so
very
much
much.
for making the time. It's
Appreciate
really
it.
fun.
Thank you.
And thank you all for your time.